The patient positioning in the NICU is very important. That is the most important aspect of the IVH bundle. So the incubator should be tilted to achieve a 20 to 30 degree upper body elevation during the first week of life in the small babies. Most of the units do it as a routine even later on because of the possible benefit with reflux as they progress with feeds. It's very important that we have the supine midline position for 3 days after birth with neutral head positioning. So the head should not be turned to the sides. The main reason is that the neck is very friable in these babies and the vessel obstruction can happen, especially the carotid vein can be obstructed when the neck is turned, and this can change the intracerebral blood flow pressures, increasing the risk of IVH. It's very important to ensure gentle handling during procedures like intubation, and there should be a caregiver reminding the person who is doing it, making sure it's not overextending or no pressure on the neck when they are handling the babies. It's better that the most experienced team handle such babies. Remember that extubation failure is fairly common. There are multiple studies which are looking at what can help with extubation failure. I have shared the Iowa experience in the very small babies, and they suggest keeping the baby intubated till almost 30-31 weeks. We don't do that routinely, but we tend to keep at least the babies below 26 weeks intubated for the first week. Don't rush to extubate them because the chances of extubation failure are higher the smaller the baby is, and actually keeping them stably ventilated is better to avoid the atelectro trauma that happens when we extubate and fail. And it's very difficult in terms of nursing skills to keep the babies extubated when they have so many other things happening at the same time. The sugar is labile, the temperature changes are labile, their fluid balance is labile. So you don't want to add more to that insult. Of course, about 26 weeks, 26 and above, they behave differently, and you can extubate them at the earliest possible as suggested in the RDS guideline. We should avoid prone position during the first week of life, and most of these babies have umbilical lines, and in practice we wouldn't turn these babies prone in any case.